As our year comes to a close, we are joined by dentist Steve Marsh, whose, focus is, of course, his dental practice and cosmetic dentistry. He is a frequent guest here and appearing with us twice a month. Every Sunday morning, you'll also see him during the 8 o'clock hour during the Today Show. So welcome back to the show, Dr.
Thanks.
Marsh.
Glad to be here again.
So we were just telling the story here before we started. You literally had a woman come into the office
just this morning.
Like, boom, everything's fixed.
Yeah, well, not everything, but she came in. She was a nurse, and she lost her front tooth, and she said, she came in yesterday afternoon as a new patient. And so we all felt so bad. I said, let's make some time. It's 7 this morning. She was in the office with her significant other. And where that tooth was, we actually bonded it with some fiberglass rib bond, it's called.
Right.
And actually placed a tooth in between. And she left today and said, oh my God, it's been loose for years, and in an hour or two, you got it done. So
you are really magic.
Well, but it was fun to do for us.
I bet. And very gratifying.
Great.
Yeah.
Very great.
Well, I mean, and with the new year approaching, I'm sure a lot of you are making those resolutions for a better you, and that, of course, includes your smile, right?
Right. Yeah. So many times people are dedicated, obviously, their weight, how they look. What a wonderful time to say, here's where I am. I want to be presentable. I want to look better, whether it's for dating or a reunion or family or whatever, just to feel better about yourself.
Feel better.
The smile, as you know, is one of the keys. You have a beautiful smile, so you really understand that.
Thank you.
Sure.
So there's a lot of options available to all of you, right? I mean, true. You don't have to...
With changes in materials and techniques, some take a little time. We stage them. Some take a long time. But whatever works for the patient is what works for us. So knowing their options makes it easier to make a decision on how to move forward.
Okay, well, let's look at some of the people you've helped, because there are many, and probably hundreds and thousands of them, but these are a few examples. Talk about what we're seeing here.
So it's an interesting story. She was a 22-year-old girl, and she was born without those lateral incisors. And she had an apparatus that she would actually put on and take off to replace those missing teeth. She did it for about 10 years. The teeth underneath them actually started to decay when she came to us. And she said, I want something permanent. Those are all porcelain bridges, Holly, 2 3-unit ones, 6 teeth across. Gave her a beautiful smile, and she was thrilled, and her husband, who was really behind getting her to come in to do it, loved it, and it was like it's life-changing for her.
Oh my goodness, I bet. And what a beautiful job you did. Now, what's happening in these photos? Okay,
so not everybody's 22 years old. So she came into me, she was in her late 50s. She speaks across the country, very well thought of. And she said, but when I meet people after I'm done speaking, I don't even want to show them my teeth. She had had a lot of old dental work, porcelain on metal. She had some root canals, posts. So we took stock of what she had. Today, with today's porcelains, we can make them translucent and beautiful, and literally, again, life-changing. On the lower teeth, we just reshaped them. Holly, she put all of her time and interest into getting the uppers done, and she said it changed her life as a speaker, but more importantly, in a personal level, it worked great for her.
It has to be so gratifying for you. I mean, at the end of each of these procedures. Okay.
Thank you.
Different set of photos
Different set of photos. Similar sort of thing. This man's a physician. Took care of everybody but himself. Family, 4 kids. Now he's in his 60s. He said, it's about time I take care of him. Those teeth at the bottom, Holly, were actually not only decayed, but they were very loose from periodontal disease. So we used a zirconium bridge, much like we did on the first patient, to fill that in. And those are porcelain crowns on the top. And he said, again, talk about life-changing, he only said to me that, or he wished he had done it earlier, but again, he was doing what he thought was the right thing and taking care of others, and now it was his turn, so to speak.
Beautiful.
And this is a very simple case. A man in his 40s, his teeth had separated over the years. He said his family had that, but because of his bite, they actually pushed those teeth out. He wanted that space closed. He was not a candidate for orthodontics, didn't want to go through 2 years of braces or any sort of guide. So we reshaped the teeth. We did porcelain crowns across the front, again, limited to the front 4 to 6 teeth to give him that beautiful smile, close the gap. again, felt much more self-confident. He was a pretty confident man in the first place, but he said he felt so much better about himself, and his spouse also liked the look too. So it accomplished a number of things. And lastly, a young woman about to get married had some bonding over the years, had some braces. You can see the disproportionate teeth, and we used porcelain veneers literally 2 months before her wedding, and afterwards she sent us pictures from the wedding and said it made her a much more confident bride and made her smiles that much more beautiful.
These are spectacular.
Thank you.
As are you. New year, new you. Call Dr. Marsh. Resolve to have that new smile. Here's the phone number, 440-461-1003, or simply clevelandsmiles.com. His office is located right at Brainerd and Cedar in Lyndhurst, and you can't go wrong. Thank you so much for all you do.
Oh, thanks for having me
so
again.
good to see you.
My pleasure.